In the meantime, we do move on to the other major news this Tuesday night, that late-breaking headline on the pandemic. Pfizer, just before we came on the air here, now requesting emergency authorization for a second booster now. So we asked Dr. Jha tonight about the idea of another booster, what they're seeing in Israeli data on this already. Also, what's being seen in wastewater here in the U.S. and what this could mean. Here's ABC's Stephanie Ramos.
Tonight, Pfizer formally asking the FDA for emergency authorization for a fourth vaccine shot for people 65 and older, pointing to Israeli data where 4 shots are authorized. We asked Dr. Ashish Jha, do we know enough yet on a second booster?
So the preliminary Israeli data does suggest some benefit for high-risk individuals, but again, it's preliminary, and I think all of us want to see a lot more of the detailed data. We want to see the experience of other places as well. And ultimately be guided by that.
We also asked about the news on wastewater and the new CDC numbers on the Omicron subvariant. CDC data shows that Omicron subvariant BA2, which could be 30% more transmissible, is now nearly doubling every week and now makes up an estimated 23% of new infections. And wastewater testing and early warning system shows 30% of sites across the U.S. reported COVID-positive samples increased at least 1,000% in recent weeks.
What we know is that wastewater data tends to precede infection case identification that we tend to see when people go get tested. And we are seeing an increase in wastewater data. By the way, we're also seeing increases in infection in Europe, obviously in other countries. And just a reminder, this pandemic is not over. I don't expect a major surge or a major spike out of this. But we may see an increase in cases, and we're going to have to see where this goes.
Overseas, COVID is resurging. China is battling its biggest outbreak since the beginning of the pandemic, imposing new lockdowns for 51 million people. And European countries are now tracking a new spike in COVID cases, fueled in part by the Omicron subvariant, BA2.
In Europe, we've seen an uptick of cases across almost all the countries of Europe, really driven by a couple of factors. I mean, one is BA2, this subvariant of Omicron that has now become dominant in Europe. I think it's a bit more transmissible. That's causing a bit of an uptick. Obviously, they've gotten rid of all mitigation measures, no masking, no distancing. I think that creates some susceptibility in that context. And maybe a little bit of waning immunity as well. So that combination is probably the explanation for why we're seeing an uptick in cases in Europe.
And Stephanie, Dr. Jha talked about some of that mitigation being dropped in parts of Europe, but the masks and other measures have been dropped here. So what's he most concerned about here at home, given these surges elsewhere, reminding us we're not done yet?
David, Dr. Jha says what worries him the most is that so many Americans are still vulnerable. He says many more people need to get vaccinated or boosted. And he also says that even though we wish this pandemic were over, it is not. But we now have the tools to manage it in a much more effective way. David.
All right, Stephanie, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.